I'm young and I have two daughters, and I knew that breast cancer ran in my family, and I'd been getting tests since I was 35, just to kind of as a precaution. And so as soon as I could catch my breath, then I wiped the tears off my cheek, and then I began to aggressively deal with it.
When patients first have a diagnosis of cancer, there's a lot of concerns. One, they want to know the exact nature of what their cancer is. They want to know the stage. How advanced is it? Is it an early, highly curable cancer? Is it a cancer that's going to require aggressive treatment for cure, or is it a cancer that is not curable? And many times, one of the things they often want to know is, what is the impact of this disease going to be on my life, my quality of life, my duration of my life, and what's the impact going to be on my friends and family? And one of the things I always discuss with them is to try and be as direct with their family members and their friends as they can, because their family and friends want to help them, they want to know what's going on, and they're also very perceptive at picking up when somebody's not giving them the whole story.
I kind of just head on. I just explained that I had been diagnosed with cancer and that I had some surgery that I was facing, and I wasn't quite sure about what was going to happen after that, and that I've been raised to just kind of be a fighter and to not give up, and that's what we were going to do, and that we were kind of all in it together, and went from there.
I think we need to let our patients know that we'll be there for them, their care team will, as well as their family and friends, and for them not to be afraid to ask the questions, the things that are concerning them, because there are a lot of resources, and that's very reassuring to learn about what options are for things that are causing fear or anxiety in a patient.
Be an advocate for yourself, ask questions. One of the biggest things that helped me is that every doctor's appointment that I went to, I had all these questions written out, because when you get in there, you kind of become overwhelmed with the doctor and the environment, and then your mind begins to race, and then you forget all of the questions that you wanted to ask. And so probably one of the biggest things that I would recommend is that you carry around a little sheet of paper or a pad, and as you come up with questions that you want to ask, you jot them down. I'll be 3 years cancer-free in January.